In a case of gross medical negligence, 4 patients died in a trauma centre in the capital due to lack of oxygen. In a shocking state of affairs, the 4 patients who were in critical care died after their oxygen supply was cut off for several minutes on Tuesday morning. The incident took place at the Sushrut Trauma Centre in North Delhi. After the tragedy, relatives of the victims staged a protest at the Delhi government-run hospital. But the blame game has begun now, and hospital authorities have said the contractor in charge of maintaining the oxygen supply had failed to ensure that there were enough backup cylinders when the cylinders supplying oxygen started running out. The deceased have been identified as Rajkumari, 35, Javed, who was just 20, Rehana, 36. A 4th person aged around 25 years has not yet been identified. There was a 5th person as well who was fortunately saved. The police have now filed cases under the IPC of negligence and causing death by negligence against the company PES Installments Private Limited. Taking serious view of the lapse, Delhi Health Minister Javed has ordered a probe. Walia said he will hold a meeting tomorrow to review the functioning of all Delhi government-run hospitals in the city.
पाइपलाइन से गैस ना आ रही थी। मैंने डॉक्टरों को भी बोला तो उन्होंने मुझे कुछ जवाब नहीं दिया और कहने लगे चलिए हटिए। मैं बाहर को आया, फिर कुछ देर बाद कहने लगे कि भाई आपका मरीज की डेथ हो चुकी है, आप मैं इसे बाहर ले जाओ। मैंने उससे कहा ऐसे कैसे हो गई है, अभी तो बिल्कुल ही सही थी।
स्टाफ डॉक्टर्स यहाँ ट्रॉमा सेंटर में उपस्थित थे। उन्होंने जब पेशेंट्स को अनईजी देखा होगा तो डेफिनेट उस समय अरेंजमेंट करने चाहिए थे। कोई डेथ अचानक एकदम तो हुई नहीं है। ऑक्सीजन की सप्लाई नहीं आई और जो प्राइवेट एजेंसी है जो ऑक्सीजन प्लांट चलाती है उसके अटेंडेंट ने भी इस पूरे घटना पर उस समय रिएक्ट नहीं किया। तो यानी कि किसी भी तरफ से कोई उस समय इमरजेंसी सर्विस नहीं दी गई। कॉज ऑफ जो सप्लाई है ऑक्सीजन वो पीछे से क्यों नहीं आया, क्यों बंद किया हुआ था, और जो डॉक्टर्स ऑन ड्यूटी है या स्टाफ ऑन ड्यूटी है उसने भी इस बात को क्यों नहीं देखा।
Well, let's go across to Sonal Mehrotra, who joins us from outside the hospital. Sonal, we heard those relatives there. Can just imagine the anguish that they're going through. One of them even saying that he saw the patient was in distress. He even tried to tell a nurse or a doctor about it, and she just sort of ignored his pleas. And later he's told that he's informed that the patient has died. So obviously a lot of anger and a blame game also underway.
Karki, the biggest question currently is that in case, even if the worst case scenario, the oxygen, the main power, the main oxygen supply to the hospital and to the ICU fail, there should have been a backup to provide and to emergency services to the patients. Remember, all this happened in the early morning hours. Now, what's into question is whether there were enough enough attendants, nurses and doctors at that time to take care and to put those even manual pumpers which are available inside the in the ICU to get into place. What we are hearing firsthand from these people, and I was inside the hospital in the ICU a little while back, is that there are cylinders available which are lying next to every patient. There are also manual pumpers which can be used in any kind of emergency services. So one wonders if it is also because this happened in early morning hours, there wasn't enough people to take care of all of them. Another sad news coming at this moment is the fact that the 5th patient is also in a very critical condition. We were there a little while back and we tried to interact to them, much
All right,
to the
Sonal, I'm sorry to
hospitals.
interrupt you there. We're also joined by Mr. S.B. Shashank, who's the Special Secretary of Health in the government, and he is a part of the probe, in fact, heading the probe committee. So thank you for speaking to us. Sir, an extremely shocking state of affairs in a government-run hospital. Patients in critical care running out of oxygen.
Yeah, in fact, government has taken a serious view about this incident. This is a really tragic incident, and a 3-member committee has been set up, and the committee has got 2 experts. One, Dr. Deepak Temple, he is HOD of GV Pant Hospital, and another is Dr. A.K. Sethi, he is again HOD of GTV, Guru Tegh Bahadur Hospital. So the committee is looking into all these aspects, and if there are any lapses on part of any individual, certainly committee will look into those.
But sir, a committee and its report is hardly going to be consolation for the families who have lost their loved ones. We just heard one of the relatives saying he'd in fact been told that in a few days he could take his wife back. The next thing he's informed that his wife has died. So obviously a shocking state of affairs in a government-run hospital.
Yes, we do admit that it's a very saddening news for all of us. It's shocking for all of us, and the government is doing whatever best can be done. And we will also look into the individual grievances of the next of the kin of the deceased people.
So this private company that was involved with the oxygen supply, is it involved in oxygen supply to other hospitals as well? We do know the minister, Mr. Walia, has called for a meeting tomorrow to review the situation across the city.
Yeah, certainly. Honorable Minister has taken a very serious view about the entire incident, and on his orders only this committee has been constituted, and it's being reviewed for all the hospitals under Delhi government, and the entire system will be seen that such things do not recur, if at all. And the committee has been given a very clear mandate to go into all the fact circumstances which led to this death, and also to identify a specific lapses in the system. It's individual lapse, or it's mechanical lapse, or it's any kind of lapse that could have happened, or operation maintenance of these equipments. All these lapses will be looked into.
All right, Mr. Shashank, thank you so much for speaking to NDTV. Mr. Shashank, the Special Secretary Health in the Delhi government, there telling us a committee has been formed that is probing the entire situation. If we can return to Sonal there. Sonal, you heard the Secretary there, Mr. Shashank, talking about this committee and how a report was going to come out and it's going to look into all specifics, whether it's a lapse on individuals' part as well. But the hospital as such trying to put it onto the private company, but obviously their attendants were also in charge and should have seen there was some stress, some discomfort among those patients in ICU.
That exactly will be the challenge in front of all the committee members, Gargi, to ensure that it's not just the private contractor who's taken down. Remember, an FIR also of negligence causing death in his name, but also the culpability which lies and the responsibility for the government hospital should be taking up. Remember, as I've been saying repeatedly, in case the main oxygen supply fails, there are systems which should come into place which the hospital can take on its own. Why that did not happen will be one of the questions the committee should be looking into. Also, what's been seeing and what we get out of the interaction with various patients inside is that there is, even today from the past 24 hours, they say there has been no water supply. Now, these things have been coming up repeatedly, not just in this hospital, in several hospitals across the capital. It goes on to show the state of affairs here, but really oxygen not being cut off has led to everybody being out. Remember, also what we can tell you right now, the fifth person who was in a critical state continues to be in a very critical state. The doctor is saying that the chances of survival are glim right now, and the rest of the rest of the hospital beds inside the ICU completely empty. So how the situation is going to go forth right now remains to be a big question, and huge and some very strict questions to be answered by the hospital now.
India's #1 news app just got even better. Download NDTV's new app. Fully optimized for Retina display. Full screen view. Faster response time. And Sudoku. NDTV's new iPad app. Download now.